Easdent teeth are standardly positioned and not custom designed. For single arch complete dentures, the denture teeth position is determined by both the facial aesthetics and the opposing existing teeth. When using Easdent tray to record the correct centric relation and VDO, only a few of Easdent teeth typically make contact with the opposing arch. The gap between the Easdent teeth and the existing teeth usually results in the Easdent teeth and its occlusal plane not being in the ideal aesthetic position. The occlusal plane may appear tilted and might need to be rotated or move closer to the opposing arch for proper alignment and aesthetics. If the Easdent teeth are positioned for better aesthetics, the VDO is usually increased due to the space between the Easdent teeth and the opposing teeth. In such cases, the lab must reduce the VDO during setup. Evaluating the aesthetics of both the Easdent teeth and the opposing teeth is very important. Provide the patient with a mirror and involve them in aesthetic evaluation process. Ask the patient to relax and to smile. Identify the facial midline, then evaluate the midline of the teeth on both the Easdent tray and the opposing arch. Determine which midline is more accurate or aesthetically pleasing. Choose one as your reference midline and give the lab clear instructions on the correct midline relative to the reference midline. Evaluate the occlusal plane on both the Easdent tray and the opposing arch. Determine which one provides a better occlusal angle and select it as a reference plane. If needed, instruct the lab to adjust the occlusal plane according to the reference plane. The incisal edge generally determines the height of the occlusal plane and the buccolingual position of the anterior teeth. Denture tooth setup is guided by the opposing teeth and aesthetic considerations. Buccolingual position of the maxillary incisors is primarily determined by the aesthetics needs for the lip support. Vertical position of the maxillary incisor edge is determined by the aesthetics and phonetics. It should be visible slightly below the upper lip at rest, typically about 0 to 2 mm. When pronouncing V and F sounds, maxillary central incisor should slightly touch the lower lip at the mammalian border. The position of mandibular denture teeth is determined by the mandibular ridge anatomy and the position of the maxillary teeth. If the opposing teeth are ideally positioned and you're aiming for a class 1 occlusion, there should be approximately 2 mm of overjet and 1 to 2 mm of overbite at the incisal edges. Due to the spacing between the Easdent teeth and the opposing teeth, when the lab sets the denture teeth into occlusion, the denture teeth are usually positioned closer to the opposing arch than the Easdent teeth. Use both the Easdent teeth and the opposing teeth as reference to visualize the ideal position of the denture teeth. Decide which reference offers better aesthetics. If the Easdent teeth have better aesthetics, with a better incisal edge position and occlusal plane height, instruct the lab to follow the Easdent teeth position to set up denture teeth. Close the video and bring the opposing teeth into contact. If the Easdent teeth are not correctly positioned and the opposing teeth are in a better position and the video is correct, instruct the lab to follow the opposing teeth. Make sure to clearly specify the desired overjet and overbite for the incisal edges. Take front and profile photos or capture face scans of the patient smiling and at rest with Easdent impression in place. These records are essential for lab communication and help ensure accurate position of the midline, occlusal plane, and incisal edges.